Congenital heart diseases are typically diseases which occur from birth. Our heart is formed by 8 weeks of life, and from then onwards we are destined to carry these defects through birth. It has been realized over a period of time that many of these defects have a genetic basis to it. Of course, there are other factors which increases the incidence of congenital heart disease, like when the mother takes alcohol, it's called the fetal alcohol syndrome. When she smokes, when she takes some prohibited drugs, the incidence of congenital heart disease grows. It is now very easy to diagnose these defects even during fetal life with the currently available technology, so that the parents can be counseled appropriately regarding the severity of the disease, their long-term prognosis, and the family can then decide how they want to carry, whether they want to carry the pregnancy and get the heart disease treated after the child is born. They vary from simple heart defects like hole in the heart to much more complex forms of congenital heart disease, wherein the child turns blue because there is a lack of oxygen delivery to the body. Fortunately, now majority of these congenital heart disease are now easily treatable, whether it is with surgery or without surgery, and most of these babies are able to lead a normal life, provided of course these defects are picked up at the appropriate time, they are diagnosed early and treatment started early. The main problem comes when they are neglected, they are not treated at the appropriate time, then of course it carries a lot of mortality and morbidity if that is done. Tremendous advancement have occurred in the diagnosis of congenital heart disease, so that it can be diagnosed right from fetal life on to advanced age. Some of the modalities that are available are the two-dimensional echocardiography, which has now been advanced to three-dimensional echocardiography for better imaging and understanding the anatomy of the heart, CT angiograms, MRI, the use of nuclear medicine technology to diagnose the heart disease and also the severity of the heart disease. With the availability of these technologies, we are able to diagnose the congenital heart disease at a much more earlier period in life, so that the treatment can be started early in the natural history of the disease, and therefore provide much more better care, much more better quality of life for these children with heart disease.